Hi, and welcome to Schmooze with Suze. I'm Suze Montgomery, your host, and this one's kind of special to me. It hit home on a very big level, and I brought with me two of my very dear friends that have traveled the same path, gone through the same situations, and I think it's time to really get this word out into the public and not the cute little pink ribbon stuff that you've heard about in the past. This show is all about breast cancer, surviving life, surviving cancer in general. So I've got Katie Haddock and Lisa Barreto with me, and both of them are very well known in the community, professional women that have gone through let's see, you're on the other side.
I am.
So I guess since the three of us were like, I'm in the middle because you're done, you're going through treatments, and I just finished mine recently. So you've got three different levels, and we're going to speak to all three of these levels of what we faced with challenges in the situations. So Lisa, maybe we'll start with you because yours is, you're still going through treatment.
Where would you like me to begin?
Okay, let's see, your story. Well, you're not a Californian.
No, I'm a native Bostonian. I moved to Santa Barbara in 1988 and then moved to Las Vegas in the 90s and then came back to Ventura in 2000. So I've been a resident here for 15 years. Since that time, I got breast cancer in 2002 while I was attending Ventura College, and I started the Ventura College Breast Cancer Education and Advocacy Group at Ventura College, which then turned into a 501c3 nonprofit called Ribbons of Life Breast Cancer Foundation, and that became a nonprofit in 2007.
And you've been this is not your first time around the park, right?
No, this is my third time around the park. I've had 4 mastectomies. Now, how is that possible?
Yeah.
2002, I had DCIS breast cancer of my left breast. I had a mastectomy with reconstruction on that breast, and they also did reconstruction on the other because they look for symmetry. And then in 2010, a new breast cancer formed in my right breast, which was an invasive breast cancer, had a mastectomy with reconstruction again of both breasts. And then the cancer, I had a cancer recurrence, a local recurrence, but in 5 spots of my right breast. And the cancer traveled in between the skin, under the skin, and the implant, and traveled to the mastectomy scar. So then I needed to have a bilateral mastectomy, which means they removed both reconstructed breasts.
Wow, that's amazing. Katie, you are done.
I'm finished. Yes, I'm finished. I was diagnosed in 2011 after getting out of the shower and seeing a red spot on my breast and thinking this doesn't look normal.
And you're a nurse.
Yes. Yeah, unfortunately I'd had a friend who had had inflammatory breast cancer, so I was familiar with the signs. So I went to my doctor, and by that time the redness had faded because I wasn't right out of the shower. And she probably saved my life because she said, no, you saw something, so we're going to track it down. So I went for a mammogram and an ultrasound, and sure enough, they found something. But we thought it was very small at that point in time. No one recognized that it was in the skin yet. So I had a lumpectomy, and then the pathology report came back, and I started heavy chemo right away, and then had a mastectomy on my left side, which is where the red spot was, and then went through intense radiation, which just burned the
Oh yeah,
pee
crap
wadding out
you.
of my chest, and then waited for about a year and had reconstruction where they took the tissue and fat from my abdomen along with their blood supply and moved them to my chest, so I don't have implants. I have
Wow, your own.
my
So
own.
less chance of rejection too, right?
Less chance of needing to do it again because there are no implants in there, no silicone in there. So it's just the fat from my own body that's just changed address. So that was in 2013, and that took about 7 or 8 surgeries to get it all fine-tuned and perfect.
You know, people, the average person doesn't realize what we have been through. I mean, our families do, because thank God we have really supportive families.
Yes.
We've got husbands that are like rocks. You know, kids, if you have kids, our kids are like, our dogs are there. Our dog
Not
never left
everybody,
my
though,
side.
is there. That's what I deal with. I deal with women that don't have families. Some,
That's why you started.
yes. Some that don't have husbands, or they have husbands that leave them because
Your
they can't deal with
organization
them.
is, let's
so.
talk a little bit about your Ribbons.
Ribbons of Life Breast Cancer
It's
Foundation.
completely different from any other cancer organization. It's the one I choose to deal with and to actually be a participant and a member of, and on the advisory board as well, because they're not selling lists of names. They're not out there with the pink stuff, regardless of the fact I'm wearing pink. But they are out there for advocacy and education. Why did you start this? Because of that? Because of the need that you saw?
I started it because I needed support, and when a group of female professors knew of my previous experience, they asked me to start it because there wasn't one on campus at Ventura College. And so I wanted something that was educational, so that I could go monthly to hear a speaker, a doctor,
Sure.
a mediator, all different types of people, talking about ways to live and talking about new methods of medicine and what alternatives or complementary alternatives can be used while you're going through breast cancer to have a better quality. Because one of the biggest concerns, other than the family and social, I'm a trained mediator. I actually went on to UCSB focusing on interdisciplinary studies and mediation because I knew that I'd be meeting with families with lots of different dynamics, different lifestyles, different belief systems, different religions, and we have a lot of variety. And so I didn't want a cookie cutter type of a group, and I wanted the women to be able to become active as they wished. And also, we have a scholarship so that we could really focus on education as being part of the recovery process.
I went through, since we all went through pretty much the same therapies, I finished my treatments probably, let's see, in radiation, I finished up in June. And it was, again, rigorous, like you said, very aptly described. I went through all the chemo, a lousy time with that, had a lot of side effects and a lot of other surgeries because of it. My body just didn't want to accept it. I think that's probably because I was so healthy before I was diagnosed. I'm healthy. I'm an athlete and I eat well. The only thing I probably don't do well is get enough rest, but I've always been that way, so that could have been an issue too. And now the new statistics is 1 out of every 3 women in Ventura County will come in to have breast cancer in their lifetime. Brand new stuff. That ought to shake you up a little bit. The need for a lot of people of a certain age that, they probably feel like, because way back when, Katie, correct me, way back when we were told not to have, we didn't need mammograms after a certain age. This is the old school way of thinking. And then it changed, right? And then it was like, okay, you hit a certain age, let's say it's postmenopausal, even more you need probably the need for mammograms on a regular frequency.
Well, they backed off the recommendations from every year to, I think, every...
Was it every 3?
I don't think it was every 3. Maybe, it might have been. I would have to go and check. But
Me too.
they really backed off the recommendations, and that scared me a little bit. Not that I'm, because I'd had a normal mammogram 3 months before I found my cancer.
Yeah, I had one 6 months before mine.
Yeah, and it didn't find mine, and it doesn't find lots of women's, but it is a good screening tool that finds some breast cancers very early before it develops into more advanced cancers. It didn't work for me, but it does
Didn't
for
work
lots
me
of
either.
women.
So, you know, it's not a perfect system. And the system, I still question a lot of the therapies. I mean, I know this is all we have, but to me, I mean, this is 2015 for crying out loud. I mean, don't we have something?
Well, we have our brains, and really what I try to talk to women about is the advocacy part of them having to just get out of the house and see a doctor if they have a lump. There are some women that aren't even doing self-breast exams. There are other women that are home with a lump, not knowing that there are resources out there so that they can get a free mammogram.
That's why your organization is so uniquely different from any of the others. It's because of your advocacy and your educational component.
Well, and we also
huge.
don't focus on fundraising.
No, you don't.
We have our community fund does the fundraising. Oxnard City firefighters, we actually opened up a new breast cancer resource center, and it was all decorated by Ethan Allen. It's a beautiful gathering room. But one of my biggest concerns has always been the education of women and what women can do for one another when the system either fails or forgets us. And there's so much that happens, especially with side effects and chemotherapy, radiation, a mastectomy, a bilateral mastectomy, reconstruction work. There are so many intricate little details that we share, but there are a lot of fear that keeps women home or keeps women not going, or they're busy women, highly educated women that know they have a lump and do nothing. And this is the part that is the real part of breast cancer. We are talking about living a quality of life versus sometimes a quantity of life. And we sometimes get to choose.
You and I
Sometimes
said
we
something
don't, but-
recently that we both chuckled on the phone. I don't know if you've ever felt this way. Once you've been down this path, once you've had breast cancer, once you go through all the therapies and you did heal and you came back and now you're going through it again. But once you have, you're always looking over your shoulder,
Oh, yes.
waiting for the next shoe to drop.
The other
Waiting for the
day-
next diagnosis. You're never comfortable again, are you?
No, and I check my scars twice a day, and
Yeah.
what's that twinge in my back, and
That's me.
and I've got a bump on my head. Honey, do you think it's breast cancer? And
Yeah, I started this little dry cough about a month ago, and I'm going, oh my God, this is what I started with the last time. you
Yeah.
I
know?
just had a scare on Monday. I went to see my nurse oncologist, and I was going over 14 side effects from the 4th round of chemo, and going down all the different side effects. And then I said, and I still have that pain on my left side since the bilateral mastectomy. And so it was on the rib, and I pushed it, and she pushed it, and I said, ow, and that's where it is. And she says, I'm going to order an immediate chest x-ray. And I said, well, can you see the cancer? If the cancer has spread to the bone, I said, I'm going to come right out and talk about that.
Yeah.
And she said, yes, you can.
Wow.
And so within a matter of 4 hours, we're sitting on pins and needles wondering if my breast cancer has spread to my bone. So you've got to find ways of seeking support. I immediately fell apart, of course, and my husband's sitting there, and he saw me with the nurse, and the nurse was like, I wish I could take this away from you. I wish you didn't have to make these decisions of whether to continue chemotherapy. All sorts of different decisions you've got to make, whether to reconstruct or not, which I've chosen no reconstruction because I've been down that road twice now.
Yeah.
So then you start talking about prosthetics, and what are you going to do as far as, do you want to go flat-chested? Do you want to go with looking like the way that everybody thinks a woman should appear? So there's a lot of things that are under the wig, under the template eyebrows, under the lip liner, in the mouth with mouth sores,
Yep.
and
ears and nose.
yes,
Had those
and
too?
and I had just recently I had hives on my head, so it's like every single one you've got to treat differently.
You know what's really interesting to me, and as a professional nurse, the amount of information you don't get from the professionals.
Yes.
For example, when I started with chemo, and we all went through the chemo thing. You sit there in the reclining chair, the big reclining chair. Everybody in the room looks like they just want to die and get it over with, or run out the door, right? Nobody looks at you in the eye. Their heads are all down like this, and I walk in there, I go, where's the, I'm like this all the time. It's kind of like, this is not acceptable. We cannot have this. We have to change this. We have to change the culture. We have to, start living again, and that was not living. But then when I asked questions, nobody had the answers. My oncologist, well, she's a clinician. She's there to, but the deadpan face. The best help I got was my chemo nurses. They are in the front lines. They knew all the answers. I trusted them implicitly. But why, there's no way to navigate when you first get diagnosed. Okay, what do I do now?
Yeah.
Right? So what do you,
Even as a nurse, I knew nothing about breast cancer because that's not my specialty.
No.
And now if somebody had been having a heart attack or a baby, I would know what to do.
There.
But I knew nothing about breast cancer. And I didn't know where I should turn because
Nobody
should I
teaches
quit
you.
my job? Should I
Yes.
sell my clothes? What are you supposed to do? So I
help.
went about educating myself and looking up all the research that I could find and doing web searches.
Right.
And I learned a lot from that. And also from talking with other women with breast cancer.
That's where we all got the information.
Yes.
And it was kind of, you had to be your own advocate, you had to do your own research, and there was so many conflicting opinions out there. I mean, if you go on WebMD, you're going to die tomorrow. I mean, this is like the worst thing you can do, right? They tell you not to do that. But of course, the morbid
you do.
curiosity,
Yes.
you're like this, oh my God, this is what this, you get panicked. But it was just weird to go through this because, okay, so now I'm diagnosed. Now what do I do? They don't tell you what to do. So I go, I guess I have to get a surgeon. I have to get an oncologist. I have to, I had to go down the list, and within 2 weeks, I had everybody online. I mean, I had everybody.
Well, see, and I consider that information to be a standard of care, which is not standard.
That's not standard
because
of care.
I requested a private room for my chemotherapy, and I got that. Not every oncology ward is set up
even
that
has
way.
one, right.
And that's another way that we need to look at how are we treating women and men that are having any kind of cancer. And I did not want to look at a group of people that were all feeling awful. And
Well, when you're diagnosed and you say the word cancer, people run for the hills. I've had people come right up to me and go, why'd you shave your head? I mean, I've had really rude people. And I mean, I've had friends that absolutely, they just kind of scattered like.
It's common. It really is common.
And you also get automated telephone calls that remind you to have your mammogram. And when you don't have any breasts, it really hits home.
Yeah.
Everything is a reminder, right? Everything
Yes.
you do all day long is a reminder that you've had it, or you have it, or you've gone through it, or whatever it is. Every single thing you do. And you can't even say some of this to your spouse. I mean, my husband's wonderful, but I don't want to frighten him about all the different things too. So I probably hold back like, oh God, I feel like crap today. Although, there's days that you do, and then, he notices, and are you okay? Of course I'm not okay, one of those things. Your personality changes. You learn new life lessons. You trust yourself more.
Yeah.
You deal with people on a different level. This is all brand new to anybody that's just been recently diagnosed or gone through what we've gone through. You try to tell that with, I call them the normies, which are the people that have never gone through this. They're confused. They don't know what to do, and they're just like helpless.
Well, and that's why with Ribbons of Life, why we invite
you.
people that are family, friends, are all included. Any student, anybody can attend what we have, which we call Breast Fests. And what they are just early morning breakfasts at Mimi's, the second Saturday of every month. And we can go there and feel like we're normal.
Yeah.
And we can have our sense of humor, we can wear our wigs or not wear our wigs, and we share information. I mean, we're going to be doing a table talks next month where we're going to be talking about the tips of the different types of things that we learned with surgery, with chemotherapy, and with radiation.
Has both of yours, starting with Katie, has your relationships changed with other people because of the experience? I mean, in a positive way?
In
Or
a
have you
positive
changed?
way, well, that could be it. But I feel like I have a different perspective on life, and it's very much the don't sweat the small stuff.
Right.
Because I've looked at something that isn't quite so small right in the face, and suddenly being late for work or not getting a project done on the deadline isn't quite as critical as it used to be.
I totally agree with that. You probably do too, Lisa. Things are not that big of a deal anymore. Not that you've lost your passion, your zest for what you do. It kind of changes priorities a little bit, like, oh well, 20 minutes late. Oh well, but I'll get there.
I also wanted people to know that, number one, this is doable.
Yes.
And number two, breast cancer is a horrible, disfiguring, deadly disease. Not that we can't make it through it, we can. Not that it's something that you can't get through, you can. But the pink ribbons that people wear, and the cheering, and the tutus, and the
Yes,
pink
the
clown
slang
wigs
words
and-
for breasts.
Yeah,
Boobs,
save the tatas. You
tatas.
can have my tatas. Just save my life.
I mean, I had, my favorite is this little boy with his mom. We're walking in the grocery store, and they're going down the aisle I am, and he's just he's holding his mom's hand. Maybe he was about 4 or 5. He's looking at me and checking me out, and he can't figure out why I have no hair and why I'm, don't look normal to him. And I went back to him, I go, I said, this is what happens if you don't eat your carrots. Mother just looked at me like, oh my God. The look on her face was horror-stricken at first, and then she goes, I didn't know it. And, I just guessed. She looks at me, she goes, and peas too. And this kind of thing. So, it's always, to me, and it probably is for you as well, an educatable moment.
Yes.
Why you can, and when you find somebody, it's like us, the sisterhood, right? And you can speak to each other this way so easily and so freely. And other people kind of like, they understand, but they really don't understand unless you go through all the, and believe me, it's suffering. I mean, the suffering that you go through, and I'm not trying to soft pedal this by any means, believe me, the chemo, the radiation, all the therapies, they're barbaric.
Well, and that's another thing. When we're talking about education, is in the classroom when I teach a women's health class on breast cancer, I will take out my prosthetic while I'm talking to them
good girl.
and pass it around. They'll pass it around and they're kind of looking at it. And then I'll show them different kinds of prosthetics. I'll show them a cancerous post-operative report. And women will donate these. They'll black out their names and all the personal information, but because of women coming together and believing in education, you pass it around and it makes it so real for them.
Well, you
and
brought
they ask
pictures
questions.
today, right? You
Yes.
gave us some photographs today that we
Yes.
will be scanning into a B-roll. And so, Katie, you brought some as well, and I'm grateful that you did, because it makes it real. I mean, we look pretty good today, right? I mean, but when we were at our lowest ebb, and when you're physically just shot and you can't even walk because of the neuropathy, because you're so shot from all the
Lymphedema.
treatments, the lymphedema, all the side effects. And believe me, there's numerous side effects. And people don't get to really see that outside of the families. And you go, gee, you look so good for having cancer. You get these kind of statements, and it's kind of like, what should I look like?
Yeah.
And it's, and I'm a sassy woman. So when somebody says that to me, it's kind of like, you guys just don't get it. And I guess they don't get it. Unless you walk the walk and been there yourself, it's probably a very difficult concept, because you're not living with this thing over your shoulder, looking back all the time, waiting for the other shoe to drop. I'm always going to be doing this. I mean, this is not my first time around the park either. And you both, I mean, you know what I'm talking about. We can sit here and talk, but nobody real, unless you've been through this. I hope this segment is educational for everybody that's watching this. It's important that you understand that we may be laughing up here and we're chuckling away, but the severity of going through this kind of a life-changing event will never change, will never be the same again.
That's quite true. That's quite true. And I don't know if you've read all the articles, but when I was going in for my first biopsy, I contacted my high school friend, Kim Lam Gregory, who was a feature writer for the Star. and invited them to the biopsy, thinking, of course, this is going to be negative. This is no big deal. But I wanted to share the biopsy with other women. So when it turned out to be cancer, Kim asked if we could keep going. And she and Karen Loberg.
Oh, Karen Quincy Loberg.
Yes, came with me through all the surgeries and all the treatments, the radiation, and just, I was astonished that the Star was willing to be that graphic with displaying the breast cancer treatment. They had a picture on page 2, but it was of me in my reconstruction surgery, laying on the operating table with 2 holes where my boobs lived and a big incision on my abdomen.
Total courage to be able to do something like
Well, I was
this.
asleep, so that was...
No, but also courageous for you, but you gave permission, because you have to give permission for these kind of photographs.
Of course, yeah.
right.
But the courageous that they would even attempt to do a story like that in depth and the severity.
I was very impressed that they wanted to get the message out that breast cancer is not pink wigs and pink tutus and pink ribbons. It's suffering. It's surgery and radiation and burns and nausea and fatigue.
And it's also our caregivers too.
Oh,
what do
boy.
they do? I mean, that is a whole other topic that
Well,
could be
you
covered
talking about
another
another
time.
topic.
Yeah.
Okay, because we're running out of time here. We only have a few minutes left. But I do want to pursue this throughout the year, this next coming into 2016. So if you would both willing to come back, I want to do more on this. This is not a one-time thing. I want to continue the conversation, and continuing the conversation is really important because it is educational for our people at home. And it's also important for all of us to stay united as we are, because it's a sisterhood. And unless you've been there, you don't know. I think the next segment is about caregiving, and I think about our caregivers that are rocks, that are a family that stood there and they could have bailed out on us. And of course, that's another fear we all have. It's kind of like, oh, I'm disfigured, and I look in the mirror and I look at John, I go, I look like crap. And he goes, you're beautiful. I mean, Bobby does the same. I mean, this is what our families do. Okay, so we will be back. You will be back. I hope you'll agree to come back at a later time during the year. And we'll continue the conversation, is what we're going to call it. So thanks for joining us, and thank you both. I love you both. Thank you for being here. This is like the best. We'll see you. I'm just going to get teary-eyed. Thanks for joining us this week, and come back next week and see us with new guests.